Right now, health officials out in L.A. County in California are telling people, please go get the measles shot after a child there recently died after complications from the virus. It's just one case out of more than 1,450 across the country, according to the CDC. Of course, for that family, it is not just a statistic. It is a living nightmare here. And these numbers are growing as the outbreaks of measles spread in nearly every state, 41 states. Talking fever, runny nose, this blotchy rash that can show up even a couple of weeks after somebody's exposed to measles. Erica Edwards from our medical unit is here. She's joining us in Washington. And it's good to see you, although never under circumstances like these when you're talking about such a horrific outcome from measles, which is a disease that there is a vaccination for.
Absolutely. This is such a sad situation in L.A. County. A school-aged child has died from measles years after having had it as a baby. It's a super rare complication called subacute sclerosing panencephalitis, SSPE for short. It happens in about 1 out of every 600 cases in babies. It is a brain disorder that can pop up to a decade after someone has already recovered from measles. It's almost always deadly. Hallie, another reason officials say to get vaccinated.
The spread here in 41 states, is this is atypical fairly, Erica, or is this something we tend to see seasonally? Help us understand that.
It can spread any time of the year. Although that big Texas outbreak is over, we are still seeing measles spread across the country, as you said, in 41 states. Right now, the CDC is reporting 1,454 cases across the country. One of the hot spots right now is Wisconsin. 25 cases in one county alone. And get this, in Utah last month, 2,000 people were exposed to measles at a high school cycling event. Now, because it takes a couple of weeks for those symptoms to pop up after an exposure, let's go over the symptoms one more time, right? Coughing, sneezing, fever, sore throat. You can have red, watery eyes. And then, of course, that rash that usually starts in your scalp and then makes its way down your body.
When you talk to doctors, when you talk to public health experts about this, what are they telling you?
Bottom line, number one, get vaccinated. But they are very, very concerned right now about the sort of the rhetoric around vaccines, the promoting sort of really falsehoods about vaccines. They continue to say, and I actually just talked with one of the heads of the American Academy of Pediatrics, still saying this is the safest and best way to prevent this virus, which, by the way, is the most contagious virus we know on the entire planet.
Erica Edwards, it's important information. We're glad to have you here sharing it with us. Thank you very much for being here.
We thank you for watching. And remember, stay updated on breaking news and top stories on the NBC News app or watch live on our YouTube channel.